Good afternoon. Our topic this afternoon is about transcultural psychiatry. Okay. So this is the second year local students. Oh, anyway, okay, transcultural psychiatry is defined as, or it's a cross-cultural psychiatry, or and transcultural psychiatry or cultural psychiatry is a branch of psychiatry concerned with the cultural context of mental disorders and the challenges of addressing the ethnic diversity in psychiatric services. So here, what is culture? So we define culture refers to the meanings, values, and behavioral norms that are learned and transmitted in a dominant society and within its social groups. So culture powerfully influences our cognitions, our feelings, and self-concept, as well as the diagnostic process and treatment decisions. So the culture influence the way we think, the way we feel, and our self-concept for our diagnosis and also for our treatment plans. Okay, so it's a set of meaning, norms, beliefs, values, behavior patterns shared by a group of people. So meaning it's a group of people. Like example, for Islam, they have something in common, like now they are observing the Ramadan. So that's part of their culture. So they go fasting. So the culture has 6 essential components. No, one is the culture is learned. So you learned it. Culture can be passed on from one generation to the next generation. Culture involves a set of meanings in which the words, the behaviors, the events, and symbols have meanings agreed upon by the cultural group. Okay. And culture also acts as a template to shape and orient the future behavior and perspectives within and between generations, and to take account of the novel situations encountered by the group. So meaning that the culture acts as a template. No? It shape and orient what will be our future. Race is a concept with scientific validity which is now highly questionable. Culture plays the role in all aspects to mental health and illness. So meaning the culture, no, has an importance, no, in terms of our mental health and illnesses. So we have here cultural formulations, a process that trains the citizens in the knowledge of their country and their common humanity while giving them moral and intellectual virtues. So here the outline for cultural formulations that is found in the diagnostic or the DSM-5. Okay. So what's the purpose? One is to enhance the application of diagnostic criteria in a multicultural environments. Two is cultural conceptualizations of distress. Three is psychosocial stressors and cultural features of vulnerability and resilience. Fourth is to enable the clinician to systematically describe the patient's cultural and social reference groups and the relevance to clinical care, and to identify the effect that cultural differences may have on the relationship between the patient, the family, and the treating clinicians. And there are 4 areas of assessment. One is the cultural identity of the individual. We will be discussing each of these after. cultural explanations of individual illness, cultural factors that relates to psychosocial environment and the level of functioning, cultural elements of relationship between individual and the clinician, and also the overall cultural assessment for diagnosis and care. So for cultural identity, the characteristics shared by the person's cultural group, evaluating the cultural identifications of areas of the strength and support, and that enhance the treatment as well as the vulnerabilities that may interfere with the treatment. So you need to identify, no, in each culture, what are the areas of the strength and support. Sample in that's part of their culture, like uh, it has a good hygiene, or uh, they're particular about sanitations. So somehow it's also uh, helping because it's lesser the infections. Okay. So what are the vulnerabilities? If you have a good sanitations, good hygiene, so this would be the strength. Okay. That could help lessen the infections, example, and what are the things that would also interfere in terms of treatment. Okay. So, and they're also to understand and explain why he or she became ill as part of the cultural explanations. So there are models of illnesses. We have what we call the moral model, selfishness or the moral weakness. And there's also a religious model, like punish for a religious failing. And we have also the magical, the supernatural explanations model about sorcery and witchcraft. So these are the models of the illness. Some believe that it's due to moral, religious, or a supernatural, or a magical, like the sorcery and the witchcraft. So the cultural factors also, they have the family dynamics and the cultural values. And cultural elements of the relationship between the individual and the children. The culture of mental health care professionals also influences the diagnosis and the treatment. We have the plan also include the use of culturally appropriate healthcare and social services. The overall cultural assessment for diagnosis and care. Okay. So we have here example of culture bound syndromes. No? Example. It's a pattern behavior of the illness where phenomenology appear distinct from psychiatric categories and unique to particular cultural setting. So these are the culture-bound syndromes and the relationship for psychiatric diagnosis. So we have here the AMOC, okay? So AMOC is a dissociative episode that is characterized by a period of depression, followed by the outburst of violent, aggressive, and homicidal behavior. So in Malayo, Indonesia, it's termed as indirect suicidal intent, okay? So here, the phenomenology, there is an exposure to a stressful stimulus or subacute conflict. eliciting the subject feeling of anger, loss, shame, and lowered self-esteem. So there is an exposure, okay? So there's also a period of social withdrawal, brooding over the precipitating conflict, often involving aimless wandering and sometimes accompanied by visual or perceptual alterations. There will be transition, usually sudden to frenzied and extremely violent homicidality with or without a brief prodromal stage of preparations. There will be an indiscriminate selection of the victims who may or may not symbolically represent the original actors in the conflict. And there will be a verbalization when present, may be frenzied and guttural or express a internal conflict. Cessations may be spontaneous but usually results from being overpowered or killed. It is typically abrupt and lead to change in consciousness, usually stupor or sleep. And there will be a subsequent partial or total amnesia, and it reported as unconsciousness or a description of darkened vision or mate gelap during the acute episode. Perceptual disturbances or affective decompensations may occur for days or weeks after the acute attack. Psychosis or depression sometimes ensues. So, as you always hear that there is an amnesia, and there's a description that there's darkened vision, meaning you cannot, it darken your visions during the acute phase. Okay. So you have also the epidemiology, precipitants, additional clinical features, and also the treatment. Everything is in your textbook. Next is ataque de nervios, no? From Latinos from Caribbean, Latin America, and Latin Mediterranean. It's a sense of being out of control. And I think the same, we have to follow this. So, an ataque de nervos can be described as prototypically composed of the following elements. One is, again, exposure to frequently sudden stressful stimulus, typically eliciting feeling of fear, grief, anger, involving the person close to the subject, such as spouse, the child, the family members, or the friend. Initiation of the episode is immediate upon exposure to the stimulus or after a period of brooding or emotional shock. Once the acute attack begins, rapid evolution of an intense, effective storm follows, characterized by a primary affect, usually congruent with a stimulus, such as anger, fear, grief, and a sense of loss of control. That's an emotional expression. So these are also accompanied by some of the following. There will be a bodily sensation, trembling, chest tightness, headache, difficulty of breathing, heart palpitations, okay? And the behavior also is shouting, crying, swearing, moaning, breaking objects, striking out at others or at self, and attempting to harm self. So as you could see, there is the patients became a little bit hostile, okay? Falling to the ground, shaking with convulsive movements, or lying as if dead. Sometimes we term it as, in layman's term, that it's actually by the bad spirit or exorcism, okay? Cessations may be abrupt or gradual, but it's usually rapid and often results from the administration of others involving expressions of concern, prayers, and the use of rubbing alcohol. The attack is frequently followed by partial or total amnesia of the events. Descriptions as following for acute attack: loss of consciousness, depersonalization, mind going blank, general unawareness of the surroundings. So the next syndrome, we have the position syndrome. This is an involuntary position trance states are very common presentations of emotional distress around the world. It's in Sri Lanka, Hong Kong, China, Japan, Malaysia, and other countries. Okay. It is important to distinguish at the onset between the position syndrome, no? The onset occurs typically due to subacute conflict or stress and shows considerable variations. It may be gradual and unspecific. Example, diverse somatic complaints such as dizziness, headache, abdominal discomfort, okay? Or sudden and specific in the form of an abrupt transition to an altered state of consciousness. The behavior during the altered state consists of the following. There's a dramatic, semi-purposeful movements, head bobbing, bodily shaking, thrashing, okay, falling to the ground, aggressive or violent reactions directed at self or others. Okay. In all cases, this state is marked by emergence of one or several secondary personalities distinct from that of the subject. Position by the secondary personality is episodic, resulting in alteration between the usual personality of the subject and the altered state. Frequently, the specific identities of possessing personalities remain undisclosed for some time, requiring the active ministrations of family members and interventions of the specialized indigenous practitioners. The outcome is variable. The total recovery also been reported at the cessation of a single acute episode, which may be of several weeks duration. Alternatively, prolonged morbidity may result or even rarely or death. We have here another one, the Shinjing Shiro, weakness of the nervous system in Mandarin Chinese, or neurasthenia, the Greek lack of nerve strength. So, the conceptual issues in cultural psychiatry. Culture plays the role in both the normality and psychopathology. The role of culture in psychiatric diagnosis is an excellent example of these conceptual issues. So, culture plays a significant role in the perception of severity of the symptoms, the disruption of the individual's functionality, and the quality of life. So, the culture is the one who could say, the severity, okay, of the symptoms. The assessment of severity is also the result of the meaning attributed to causal or pathogenic factors of psychopathology. Okay, it's the result, no, attributed by the cause and pathogenic factors. Judgment about level of dysfunction and the quality of a patient's life involve elusive concepts such as happiness, well-being, and all of and the peace of the mind. So, like for example, what's the cause of the severity? No, what are those psychopathology that label the patients or progress the patient into severe? So it's again the culture, no? Like if someone has, example, if someone has a heart problem, so it depends on the culture. Some culture would say that there's no hope, there's no chance of our patient will just die soon. So it's actually depends on your assessment, and and also attributed to the cause of the pathogenic factors. Judgment about the level of dysfunction and the quality of patient's life involve elusive concepts such as happiness, well-being, and the peace of mind. So, just to summarize everything, that every person has its own, it's unique, and they have their own culture that is being followed. And the culture became the template, or it shapes out the future. And also the culture, it's plays the big role, okay, in terms of the symptoms, in terms of the functionality and the quality of life. Okay. So, and your meaning attributed to the cause of the pathogenic factors or psychopathology. Actually, we have different, in any countries, we have different culture, like for example in Islam, they need to bury the dead body within 24 hours. Okay, so that is their culture. So like Christians or Roman Catholics, they need to have it in the funeral parlor for 9 days or more, or less, uh because they need to have a prayer to until such time that it would also finish the prayer and the end of the stay at the funeral parlor. So it depends also on the culture. So like for example, there are also culture of some women who deliver their baby, then they are not allowed to take a bath for for a month. So that would also gauge, if it's a strength or a weakness in terms of hygiene, in terms of infections. So the culture also uh would determine the severity of the symptoms depending on the cause of the pathogenic factor. So the culture actually plays the role in diagnosis, the severity of the symptoms, in the diagnosis and the treatment plans of. So we should always be also culturally sensitive to our patients. So like patients who are dying patients, or patients, some would not like to have it a postmortem because they need to be with the patient, or a dying patient, or patient who died, because they still believe that they could still hear, they need to talk, and they need also to be with the dead body, because for them, they need to have the final uh breath of the patient that they are with them, because that's also part of their culture. So actually, everything that I discuss is all in your textbook. So you can message in our group chat, or you can, and also the rest of your time you read more on the transcultural psychiatry, and everything is discussed in your textbook. So that is the lecture. Thank you. Grabe, ipadala. Ayan. Uy, ano, ulit ang